Hey everybody, I just wanted to give you a little bit of feedback and kind of lead into our topics for this week. First of all, I finished grading your work from week 5. I got to say, just really nice job writing about disease management tools. You guys have really gotten into a good rhythm in terms of, finding supporting data to support what you're writing about. And it is probably no coincidence that the topic for this week, disease management, there are just plenty of data sources out there to talk about how um, disease management tools, most of them have a significant technology component to them, do have a positive impact. And, it was probably about half the class wrote about diabetes, which was fine. There's a lot written on that, so it's kind of fun for me to read the different perspectives. But some of you wrote about other things and you did a fine job of that as well. But one thing I just kind of wanted to call out that you guys did a great job of, but this is what really speaks volumes to being able to use technology to help manage a disease. So, for example, with diabetes, many of you talked about, those of you that wrote about it, talked about how much money is spent. It is a chronic condition, and how much we spend treating it. Now, depending on what data source you look at, you might have got different numbers. But one of them I've read that's fairly accurate is, roughly $38 billion a year is spent on treatment and management of diabetes. So $38 billion, and that's just in the US, right? So think about the impact to that, and think about if we're able to deploy a technology solution to help with that. Okay, and then suddenly we say, all right, I can reduce my spend by, let's say, even 1%, okay, or even 10%. Okay, you don't have to be a mathematician to know that 1% savings off of $38 billion is pretty freaking significant. 5%, 10%, very obtainable, right? And if you look at diabetes is something that I find very interesting, and I'm going to preface this with I am not a physician here, so if I say anything clinical that does not add up, it's certainly not my intent. But when you look at something like diabetes, one of the things that can result in unnecessary hospitalizations and diabetics that find their situation out of control is poor management of the condition, right? So this is where technology plays a major role. And I think at least 3 of you wrote about continuous glucose monitoring. Huge technology component to that, right? Where we're already at the point and have been for a couple of years now where we're using wireless glucose monitors to where a sensor is, affixed to your skin. You can use the cell phone in proximity to scan that sensor and let you know what your glucose is, and get dang near real-time results. So suddenly I can see the impact of eating that ice cream or having that cookie or that sort of thing. So if I can know more real-time, I can make changes in my health and my dietary decisions, my lifestyle choices that hopefully keep me out of the doctor's office, and better yet, keep me out of the emergency room. And anytime we can stop someone from going to the emergency room, that's a huge saving. So great job writing about that. Like I said, I always enjoy kind of reading about that. But then it's also kind of depressing too when you see how much money we could potentially save if we truly embrace the technology. I digress. On that note, this week you'll actually in week 6 you'll get into talking about new technology products, and part of your assignment is to write about the pros and cons of a new or emerging IT product. All right. And one thing the assignment asks you to do this week is actually create a summary table of pros and cons. You can go about this one of 2 ways. You can put it in the body of the paper, and some of you have been doing that already in your papers. You've been putting data tables in. It's perfectly fine in the body of the paper. You can also put it as an appendix if you would like. Either way is fine with me, just as long as it's in there. And you'll just use Microsoft Word to do insert table. And there's an example of that out there in Blackboard, so feel free to take a look at that. But again, get into, you guys have gotten, again, a real good rhythm of this, but talking about, what it costs to deploy. Okay, what are the impacts to patient outcomes? How does it impact your staff, your employees? And another thing that people don't think about oftentimes until it's too late is, how does this integrate with my other systems? All right. So we oftentimes don't put that all together until we've already purchased the software package and go, uh-oh, now we have a problem. So as I talked last week, that's the big thing when we talk about acquiring a new technology solution is what is this going to do to patient outcomes? That's our first question. And then those downstream questions, while also important, need to be asked as well. Think about how it all fits together. So again, I want to emphasize fantastic work in week 5. I was really impressed with what I saw there. You guys did a really nice job. I gave you all some independent feedback as well. So as usual, if you have any questions, please don't hesitate to reach out. I think I'm past all my technology issues, so I was able to get those graded a little faster for you this week. So I look forward to your discussion this week and your writing. And as always, let me know if you have any questions, and I hope you guys have a great week.